Hello. How are you doing? Great. I'm not doing too bad myself, thank you. So it looks like I have you booked for a cranial nerve exam today. Is that correct? Perfect. Well, my name is Dr. Calliope. Very nice to meet you. I'm the neurologist here at this clinic, and I will be conducting your exam. If you wouldn't mind, I'd just like to look over your chart real quick. So it seems that you are a new patient for me. Looks like I may be seeing you in the future. So we have you booked in for a C&E due to a concussion, is that correct? Okay, and when did you sustain this concussion? Okay. Alright. Ooh, yeah. Yeah, that sounds like it hurts. Well, your prognosis is looking great. So, is there any particular reason you decided to switch neurologists? Okay, ears are tired. Quite common. Alright. Well, this is looking pretty great. Your history looks pretty superb for your age. Your family history, great. No bleeding, no issues afterwards. Well, concussions, we've got to watch out quite a bit. I mean, your head is literally bouncing around in your brain. Your brain is bouncing around in your head, and not a fun trip. Definitely not a good roller coaster ride for your tissues. So, I suppose we will just get started. Let me just grab a pen here. Oh, darn. Ooh, pockets. Literally have everything in here. Okay, I don't think we're going to be starting an IV. Don't need that. And you don't have any communicable diseases. Don't need that. Okay, I know I have it here somewhere. Would you look at that? Right in my pocket. So, why don't I go ahead and just roll up my sleeves? Let's go ahead and get started. Yes, it's been quite hot in the office, although we have a newer office, geothermal. It's still been subject to the heat wave we've been having. Been staying hydrated, I presume? Great. Yes, we don't need you going to the ER for another completely different reason related to your health. Although really, we don't want a trip to the ER at all. Okay. So, cranial nerves. We like to check these because, well, as you had a concussion, we want to make sure that everything is going A-okay around in your noggin there. Okay? So, cranial nerves, though, they're a little bit of a sort of mystery to most common folk. However, it seems that many people are starting to learn more of their significance as this kind of newish thing called ASMR likes to create these role-playing videos of C&Es. So, I can grab a book real quick. So, my good old friend Henry Gray, author of the wonderful and indispensable Gray's Anatomy, ooh, look at that. Doesn't something like that just real get you going? Alright, let's see. Page 700. Okay, cranial nerves. The cranial nerves arise from some part of the cerebrospinal center and are transmitted through foramina into the base of the cranium. They have been named numerically according to the order in which they pass through the dura mater lining the base of the skull. Other names are also given to them derived from the parts to which they are distributed or from their functions. Taken in order from before backwards, they are as follows. First, your olfactory nerve, your optic, your motor oculi, your trochlear, your trifacial, abducent, facial, auditory, glossopharyngeal, vagus, spinal accessory, and hypoglossal. Thank you, Mr. Gray. So, all in all, these nerves help govern your senses, your movements, and some other little bits and bobs. But all in all, we need to just make sure that they are in tip-top shape. Okay, so now that I've given you my incredibly long speech, would you mind just confirming your name and date of birth for me? All right, awesome. Let's go ahead and throw on a pair of gloves real quick. All right. So what else is going on for you today besides this very exciting exam? Oh, sure. Sounds great. Oh no, I'll be at the office all day. It's almost like I live here. Alright. Now we're all clean, or at least you'll be clean from me, and we can begin. So, real quick, I'd like to do just a sort of basic examination of your facial parts. That's alright. I'll be getting quite close to you. Do you mind if I touch you? Okay, I'm not going to be manhandling you real hard, but I'm going to be just feeling a little bit, seeing what's going on. Okay, great. So let me just go ahead and get a look at you. Check your symmetry. See that all your parts look at least relatively normal. Of course, you look relatively normal. Okay. Alright. Now look at your eyes real quick. Okay, I'm just going to hold that open just a smidge. Alright. Sclera looks clear. The tissue is not red or inflamed. Perfect. Okay. Now your nose. And do something a little impolite and look up your nose real quick. Okay, if you'll just tip your head back. Thank you. Right, no obstructions. Looks healthy. And if you'll just open your mouth for me. Stick out your tongue. There we go. Okay, no abscesses. Your gums and teeth look pretty healthy. Now if you'll just turn your head for me, just want to look at your ears. Okay, the skin looks great. The opening of the canal is not red, not inflamed, no lacerations, which, believe me, can happen more than you think. You'll just turn the other way. Oh, superb. You are a fine specimen, my dear. Right. All clear, no inflammation or obstruction. Within normal limits. Alright, very great. So, let's begin with your first nerve, which would be your olfactory nerve, which would be your nose and sense of smell. Okay, so I have a little container here. well, rather, I have a few of them, and I'm going to open them up, have you smell them, and tell me what you smell. Okay? Pretty easy, pretty simple, shouldn't be too hard. Okay? Alright, so I want you to go ahead and close your right nostril for me. Okay, I'm going to hold this up to your left and just tell me what it smells like, okay, dear? And take a nice big sniff. It smells like chloroform? No, okay. Alright, and what was that smell? Perfect, okay. Alright, now I want you to take your hand off your right ear and go ahead and put it on your left. Okay, hold this to your right nostril and sniff. Okay, cinnamon, awesome. And for this last one, I want you to have both nostrils open. Okay, go ahead and smell. Lemon, great. Alright, peppermint, cinnamon, lemon. Perfect. Now we're going to do a little tag team this time. We're going to tackle a few different nerves. So we're going to do your optic nerve, your oculomotor, your trochlear, and your abducens. Okay? Yes, this would be 2, 3, 4, and 6. Right. A little odd, but we don't control how our nerves go in order into our skull, do we? So, most of these will guide your vision and eye movements. So, let's do something a little fun here. I want you to close one eye for me. Okay, doesn't matter which one, go ahead and cover it. And we're going to do something called the finger wiggle test. So I'm going to hold 2 fingers in the air here, and I'm going to wiggle one. And if you would just like to point to it, if you would like to say left or right, doesn't matter to me. Okay? All good? Perfect. Cover that eye. Great. 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 Okay. Awesome. Alright, perfect. I'm just gonna set this right here, actually. Good there. Okay. So now we're gonna do a little something called follow the finger. Alright? So I'm just going to have you keep your head still. Don't move it around. I only want you to move your eyes. Okay? So I'm going to start here and just go ahead and follow my finger. Just follow the finger. Great. Okay. Looking great. So, you know what I forgot to do? I forgot to do your other eye for the finger wiggle test. How silly of me. I get quite excited when I'm around you. So if you want to go ahead and cover your other eye, please, we'll try that once more. Okay? Right. Great. now I'm going to just step aside a little bit. I want you to go ahead and stare at my finger and then stare at the wall behind me, okay? Okay, stare at my finger and stare at the wall. Go back to my finger and back to the wall. Okay, and stare at my finger, stare at the wall. Back to my finger and back to the wall. Great. Alright, now I want you to follow my finger. We're going to go here and in. Awesome. Follow it again. In. Great. Okay, I want you to go ahead and look up for me. Look down. Look to your left. And look to your right. Okay, close your right eye. I want you to look up. Look down. Look to your left. And look to your right. Okay, and go ahead and close your left eye. Look up. Look down. Look left. And look to the right. Great. Alright, so get my little handy dandy light tool, not the laser. That would be a little odd. Okay, so I have a little light guy here, and what I'm going to do is get some direct and consensual responses, okay? So when I shine it into one eye from a diagonal sort of movement, then I will get that eye to dilate. A consensual response would be your other eye dilating as well. Okay, so keep both eyes open and shine it into my right, I suppose your left. Direct. 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 Okay. Consensual. 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 Okay, and from the other way. Direct. 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 Okay. Consensual. 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 Okay, great. Okay, so now we're going to do a peripheral vision test. I'm going to have one of my fingers come into your field of vision or move out of it. I want you to tell me when it comes into your field of view or when it moves out of your field of view, okay? I want you to close your left eye for me. Great. Okay. 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 And close your right eye, open your left. Okay. 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 Now I'm going to go out of your field of vision, so let me know when you can't see it any longer. Keep your eye closed. Great. Awesome. Okay. Okay. Go ahead and open that eye, close the other. Great. Okay. Okay. Great. Alright, you're looking pretty great. Let me grab my otoscope real quick and we'll get a little bit of a deeper peek. Alright, so this has a light on it and a magnifying glass. We're not using the speculum. We don't need a speculum for your eye. So there's the light. Okay, so I'm going to look into your left eye. Left, right? Yes, that's your left. Okay, now I want you to look up for me. Look down. Look left. Look right. Okay. And the other eye. Look up. Look down. Look left. Look right. Okay. Let me just go ahead and take a look. Okay. Alright, perfect. Let's go ahead and put that away for the moment. Now, if I'm not mistaken, it looks like you've had an eye exam pretty recently, is that correct? Okay. I don't feel like we need to do the Snellen chart then if you have gotten an eye exam. Did you go in for anything in particular? Routine? Anal glaucoma. Yeah, I get that myself from time to time. Yeah, usually my rent being due, that's generally the cure. Okay. Let's go ahead and move on. We're going to work on your trigeminal nerve, nerve number 7. So, or rather, nerve number 5. Gosh. So, I'm going to be touching certain parts of your face. I want you to tell me when you feel them, okay? So, let's go ahead and begin. I want you to close your eyes. Perfect. Okay. Okay, where was that touch? Great. Okay, and where was that? Okay, where was that? Okay, where was that? Okay, I'm going to touch you on both sides of your face, and I want to make sure that you are feeling it where you feel it, and that it feels the same on both sides, okay? My apologies for the train. Not much I can do to stop that. Okay, touch. And where was that? And did the touches feel the same or different? Okay, touch. Perfect. Did the touches feel the same or different? Did they feel the same or different? And where were they at? Okay. Alright, now I'm going to do a little bit of touching on different parts. I just want you to tell me where and left or right, okay? Touch. Okay. Touch. Okay. Okay, touch, okay, touch. Oh, almost got you there. Both sides at the same time. Okay, so I'm going to do the sharp or blunt object test. It'll be just a second. Okay. So we're going to use a super mega sanitized pair of tweezers. Now, these ends are sharp, but not nearly enough to break the skin or draw blood. But it is going to be a little prick. And I have a Q-tip, cotton bud, whatever you'd like to call it. Sometimes death of ear canal. That's what I like to call them. Okay. Now close your eyes for me, and I will touch different parts of your face. I want you to let me know if it was soft or sharp or soft, rather. Okay? Touch. soft or sharp? Okay. Touch. Soft or sharp? Touch. Soft or sharp? Okay. Touch. Soft or sharp? Touch. Soft or sharp? Okay. Touch. Soft or sharp? Great. Alright, darling. Now, if you'll just clench your jaw for me, I want to feel the muscles in your master there. Clench. Clench your jaw tightly. Great. Alright, now let's move on to actual number 7. And let's go ahead and do that facial nerve of yours, okay? I'm going to have you make a bunch of different faces. I'll do them with you so you don't feel so stupid and I feel more stupid than you. Okay? Sounds great. So, I want you to go ahead and raise your eyebrows for me. Great. I want you to frown for me. Can't quite frown on command. Okay. Smile. Smile and show your teeth. Smile wide for me. Okay. I want you to close both of your eyes tightly. I'm going to try to open them. Resist me, okay? Okay, great. And puff out your cheeks for me. Great. Hey, we're almost done with our cranial nerve exam. At least the actual exam of your nerves. So let's go ahead and look at your vestibulocochlear and check your hearing and balance, okay? So what I'm going to do is cover one of your ears as you have your eyes closed. I'm going to whisper numbers into it, okay? Just go ahead and repeat back to me what you hear. Great. Close your eyes. Okay. 1, 5, 8, 3, 6. Okay, how was that? Perfect. Yep, you repeated everything back to me like you were supposed to. Okay, keep your eyes closed. 2, 5, 7, 0, 9, 8, 1. Okay. Pretty good? Alright. Now I am going to do some finger rustling, and I just want you to let me know what side you hear it on, okay? So I want you to close your eyes for me. Great. And okay. 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 Great. Great. Awesome. Now I'm going to rustle my fingers into one ear or the other and just have you tell me when you don't hear it any longer. Okay? Okay, great. Alright, only a couple to go with. So let's go ahead and check out your glossopharyngeal and your vagus, which are for your throat function, your swallowing, and your heart rate. So seems I have lost my tongue depressor. So I'll just have to be extra careful and watch a little more closely. So I want you to open your mouth very wide for me and say ah. Just a second. There we go. Alright, go ahead and say ah. Awesome. UV looks great. Now I want you to say the word ka. Okay? And the word go. Ka. Go. Go. Ka. Alright. One last thing for me, dear. Will you swallow? I'm going to put my hands on your throat. I'm not going to put any pressure. Just want to feel you swallow. Please don't make that dirty. Great. Okay. I want you to go ahead and shrug your shoulders for me. Just a nice, easy shrug. Great. Okay. Movement doesn't look hesitant, doesn't look forced. Awesome. Now I'm going to have you raise your shoulders. I'm going to try to push them down. Do not let me. Okay. Go ahead. Great. Now if you'll just turn your head to the left for me. Okay, and to the right. Great. Alright, now the best test in the world for your hypoglossal nerve. I want you to stick out your tongue. Okay, and move it from side to side. Alrighty, perfect. Stick your tongue back in, please. Alright, well, that concludes our cranial nerve exam. Now I can move on to a couple different things to get a little bit more of an in-depth look at how your cranial nerves and neurology outlook looks like, okay? Alright, great. Alright, dear, if you don't mind, I'm going to take off my gloves. And we'll get it together for our Q&A session. Alright. If you'll just let me get it together for a second. Okay, we're going to do a little bit of a neurology assessment, alright? This is just going to help tell me that the different parts of your brain are communicating A-OK to each other and we don't have anything to worry about. Right, so for your orientation to time and location test, would you mind telling me where we're at currently? Okay, and the city, state, and country. Great. Do you know approximately what time it is? Okay. Now for your attention test, I'd like you to repeat a short list for me. Okay? Your list is going to be mountain, river, tree, cloud, grass. Awesome. Okay. Would you mind describing an event for me from the recent day or two? Okay, could be just what you had for lunch, or maybe how your commute to work was, anything of that nature. Okay, yes, that just helps us with recent memory. And if you could describe a memory from the distant past. Okay, very short and sweet. So we're going to do a little bit of abstract thinking. Would you mind interpreting the proverb, "A rolling stone gathers no moss"? Yep, think for a second. Okay. Alright. Great, yep. Much more in-depth than I would personally think, but I'm not the one being examined. Although maybe I should be the one being examined. We'll save that for another day. Okay, would you mind naming me the last 5 presidents and the state capital? Great. And how are you particularly feeling about the day? Okay. Alright, I want you to put your right thumb over your left ear and stick out your tongue. Yep, I need you to distinguish right from left. Yep, not too hard. Just like that. Great. Okay. Now, let me grab a few objects real quick. Okay, you could just hold out your hand for me. I'm going to place an object into your hand, and without looking at it, I want you to tell me what it is, okay? Alright. Okay, yep, it's a battery. You can feel it from the tube and how heavy it is and the little ridge on top. Okay, and another. Yes, common household item. Pretty much everybody knows what it is. It's just a regular hair elastic. And last one. Great. Yeah, it's a little tricky. It's a sponge piece. Most people, as soon as they squeeze it, then they know what it is. Okay, now I want you to hold out your arms in just sort of this fashion, but down. Okay? I'm going to touch you in one place or in 2. For example, this could be like once on your hands or once on each of your arms at the same time. Okay? I just want you to tell me where you feel the touch. Alright? Okay. Okay, on your right arm. Left hand. Both hands. Both arms. Okay, your wrist. Arm. And fingertips again. Great. Alright, we're going to do a little bit of an art test here. So I have a small little notebook here. If you could just draw me a cube real quick for some spatial relationships, that'd be great. Okay. Alright, looks great. Alright, darling. For the last part of your exam, as you have been passing with flying colors, we are going to do some reflex testing. So let me go ahead and get my little wooden mallet here. And we are going to do something called a biceps reflex. If you'll just hold your arm out for me. Okay, so I'm going to go ahead and hammer the kind of pit of your elbow there, which is actually called the cubita fossa. And I am going to just go ahead and hit that pretty softly, okay, but firmly. Yeah, I'm not going to whack it on you, alright? And your arm should, well, we'll just see. Okay, great. And other arm. Okay, great. So your arm jerked up a little bit. Great. Okay, so now we're going to go ahead and do the supinator reflex. What I'm going to be doing is using my little hammer on your brachioradialis muscle, okay? Alright. Hold out your arm and... Okay. Okay. going to do our Extensor Digitorum Reflex, right? These are all pretty complex names. So what I'm going to do is I'm going to tap on that muscle while your fingers are relaxed, okay? Just hold them relaxed. Okay, ready? Okay. Okay, yes, your fingers moved or contracted a little, so that works almost like when you are messing with your tendons here and your fingers sort of jerk a little bit. That's how that works. Alright, let's do our good old-fashioned knee jerk reflex. So I'm going to go ahead and hit this or gently tap this on your knee, okay? Right. Great. 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 Okay, we're going to do the ankle jerk reflex, okay? So I'm going to set that down real quick. I want you to relax your foot. I'm going to support your foot, and then I'm going to tap your Achilles tendon, okay? All right. Okay, just hold your foot up there. Okay. Great. Alright, so now I'm going to do the last reflex, which is your jaw jerk reflex, okay? So I'm going to tap at a downward angle just below your lips, and I'm going to have you have your mouth slightly open, okay? Alright, let me just go ahead and... Okay. Great, okay. So really what should happen with that is pretty much nothing at all, which is what happened. Yes, we get worried when you actually have a reflex in that area, as there's not really supposed to be much going on. But if you really have a reaction, that's what we're looking out for. Alright, my dear. You are looking excellente. I'm going to sign off on this, okay? And I think that while you have an excellent bill of health here, I want to see you back in, let's say, a year, and maybe 6 months if you start noticing any problems. You're noticing any headaches, any muscle weakness, any sort of tingling, any kind of thing like that, okay? Alright, those are some of your neurology symptoms that then we should be a little concerned about. So, until then, I don't need to see you. I don't need any follow-up. I just want you to focus on getting better. Alright? Okay. It was very lovely meeting you, and I look forward to working with you in the future. Okay. You have a great day now.